Thank you very much. Let me say good afternoon to all of you, and thank you very much for coming out this afternoon to share in these stories and to hear real-life testimonies about what healthcare is and is not in this country. And so thank you for your testimony, and thank you for your presence today. It is true that I am going to have to leave momentarily. I've got to speak at Halifax Community College at 1 o'clock. I've sent word to them that I'm going to be about 10 minutes late, but I am going to have to leave momentarily. But thank you for your friendship. Thank you for what you do in the Rocky Mount, Edgecombe, Nash County communities. I know what OIC has meant to this county for many years. And now OIC is reaching beyond the walls of the classroom and has entered into healthcare and other related industries. And I want to thank you, Ruben, for your leadership, and thank you for what you're doing. You know, when we passed health care that, I guess it was that Sunday night, Nancy Pelosi, the Speaker of the House, the phenomenal Speaker of the House, came up to me after the vote and gave me a big hug and looked me in the eye and said, GK, I know this was a tough vote for you. I know you're from a southern rural community, and I just want to thank you for being strong in your willingness to vote for health care reform. And I looked Nancy squarely in the eye and I said, Nancy, I hate to disappoint you. This was the easiest vote that I've had to take in my 6 years being here. I told her that it was an easy vote because the people of my district need health care reform. 110,000 people out of 600,000 have no insurance at all. And then I knew about the stories that we have heard today, and so I knew that we needed it in my congressional district. I was traveling in Elizabeth City about a year ago and went to DeVita Dialysis Center and saw a gentleman there who was receiving dialysis treatment, and he called me over to his station and said, Congressman, I need to tell you my story. He said, 4 years ago I was diagnosed with end-stage renal failure and I needed a kidney transplant, and the good news is that my sister qualified to be a donor. And so Blue Cross Blue Shield, my insurance carrier, was willing to pay for it, and I received the transplant from my sister. And it was a successful procedure. And I got my health back, I went back to work, and I was doing fine. I had to go on anti-rejection medication in order to sustain the kidney. He said, and they were willing to pay for the medicine. He said, but what I did not realize was that after 18 months, the insurance company would not continue to pay for anti-rejection medicine. And so because of that, after 18 months, Congressman, I lost the medications. I could not pay for it out of my pocket, and because of that, I lost the kidney. He said, a perfectly healthy kidney, I was doing fine, and now I'm back on dialysis, very sick. It's costing the government hundreds of thousands of dollars to maintain me in this position. And so I thought about him immediately when Nancy thanked me for my vote, and so that's the reason I voted for health care reform. It was a very easy vote for me, regardless of the consequences, but I don't think the consequences will be negative, because I think history will look back on this debate and see this was the right thing for us to do. We have a broken health care system in America. Every American citizen should know that. We have a broken system. And there are three reasons why it's broken. There are many more than that, but three main reasons why it's broken. First of all, we have a Medicare system that is very expensive. Medicare was started, as the young lady said, in 1965 by President Lyndon Johnson. Medicare is an entitlement program that every senior citizen in America, age 65 or older, whether it's Warren Buffett or Bill and Melinda Gates, or whether it's a low-income resident of Rocky Mount, every senior citizen is entitled to Medicare. It is a wonderful program. The problem is that Medicare is terribly expensive. My generation is beginning to age, and as my generation ages, and we're called the baby boomers, and when we get to age 65, large numbers of people are coming onto the system. And plus the cost of health care is very expensive. And because of all of these things, the cost of Medicare is just exploding. It's growing exponentially. Every year the cost of Medicaid gets more and more and more expensive. We cannot continue to sustain the expensive cost of Medicare. We have no intention, and we never did have any intention, of cutting Medicare services. but we've got to get the cost of Medicare under control. If we don't control the cost of Medicare, it will eventually bankrupt our nation. We have no choice. The other problem we have is that 50 million Americans, many of those live right here in Edgecombe and Nash counties, 50 million Americans have no insurance whatsoever. They get sick. They stay home, they medicate, they stay out of work, they get sicker. They get to the point that they are so sick, they go to the emergency room, they go to Nash General or Heritage over in Tarboro. They go to the hospital, they get a couple of aspirins, they come back home, and it gets worse, and it gets worse, and it gets worse. Finally, the patient goes back to the emergency room, they're admitted to the hospital, stay 2 or 3 days, Dr. Avant, and then they're discharged. A week later, they're back to work. Well, then 30 days later, they get a bill. They get a pathology bill and a pharmacy bill and a hospital bill and a doctor bill and radiology bill. All of the bills start coming in. Then there's a $20,000 obligation on the part of this low-income family. They're not able to pay it. The credit is ruined. They may have to file bankruptcy in some cases. The hospital doesn't get paid, and everybody suffers. The employer suffers because they don't have the employee at work. And so we've got to find a way of providing insurance to 50 million Americans who have no health insurance. Now remember, there are only 300 million people who live in this country. With 50 million uninsured, that's 1 out of 6. And that is unacceptable in our country. And so we've got to find a way of insuring the 50 million American citizens who have no insurance whatsoever. The third problem, ladies and gentlemen, is that we have 175 million Americans who have insurance. They have insurance, and they're proud of their insurance, and they think they have a good policy. Where the fact of the matter is that many of our insurance policies that are provided by employers, in some cases, are not worth the paper they're written on.
That's right. That's right.
I had an instance, a situation in my hometown a few months ago where I went to an auto mechanic shop, and the mechanic came out and said, "Congressman, thank you very much for your work on health care, and I need to tell you my story." And he proceeded to tell me that he had worked at this company for 10 years, that he had group-sponsored or employer-sponsored insurance. They take $200 every month out of his paycheck, but then he told me he had never used the insurance policy. And I said, "Explain to me why you haven't used it." He said, "I've got a wife, I've got children, and we all go to the doctor every year, but I've never used it because it has a $5,000 deductible. And I spend $200 a month for this. I don't know what my employer pays every month, but I have never, ever used it. And as far as I'm concerned, I am uninsured." And so that's an example. So of the 175 million people who think they have insurance, for all practical purposes, many of them do not have insurance at all. Add to that the fact that the price of insurance premiums, have been growing at the rate of 18% per year. That is very expensive. The cost of insurance is going up much faster than pay increases in our country. And so it's getting to be unaffordable for the family and for the employer. If an insurance policy costs $800 a month, and the employee pays $400 and the employer pays $400, by next year that insurance policy is going to be $950. The next year it's going to be $1,100. It's growing at the rate of about $150 per month per year. And insurance companies are responsible for this explosion in the cost of insurance policies. And so we've got to find a way to not only insure those